Hi everyone, my name's Finlay Green. I'm an evaluation lead at Dartington Service Design Lab and I led the independent evaluation of the LEAP programme as a whole. I'll be sharing a little bit about what we did and how we did it before handing over to our stellar team of community researchers, Anita, Kambo, Natoya, Whyte and Skowron, who were led and supported by Hart, who'll tell you more about their brilliant work. So, child development unfolds within a unique context. The people and places we grow up with and in constantly interact, shaping our development. It's not just about our brains and bodies, it's how they adapt to a complex, ever-changing world. LEAP aimed to be a positive force in this context. So by introducing new resources, relationships and ideas, it sought to enhance child development in Lambeth. But we can't view LEAP in isolation. Any impact it had was a result of its dynamic interaction with these environments around children. Dartington's challenge was to untangle this complexity, to determine how much LEAP contributed to better outcomes for children and families in the area, and to understand which children benefited, under what conditions, and why. Sounds straightforward in theory, but the reality is much more challenging. So how did we navigate this complexity and measure real impact? Well, we began by developing a theory of change to guide us. So, put simply, a theory of change sets out how a program is meant to work. We built on LEAP's original theory, adding more detail on the context surrounding children, families, and LEAP itself, and how these parts of the puzzle might shape children's pathways through LEAP. Next, we gathered both qualitative and quantitative data on every part of our theory of change. As well as analysing quantitative data on children and parents to look at LEAP's impact, which you'll hear more about in a second, we collected a comprehensive bank of qualitative data, 23 focus groups and 58 interviews with a total of 121 participants, including 52 parents and carers. Each piece of data was like a small tile in a larger mosaic of evidence, helping us understand whether the interactions we expected to see actually took place. And by examining how these pieces aligned or conflicted, we built a clearer picture of LEAP's real contribution. Making sense of this data wasn't straightforward. There's no magic formula. Each piece of data came with its own limitations and caveats, so we worked together with LEAP and others, iteratively refining our interpretation over time. And when you do evaluation that way, rigor comes from the inclusion of multiple voices. Doing this evaluation right also meant thinking about how data was collected and by who. Decisions around what gets evaluated and how too often exclude those being researched, including practitioners, communities, and families. That's why this evaluation incorporated multiple voices throughout the evaluation process and not just at the interpretation stage. Most importantly, through building a team of community researchers, local parents who formed a core part of a multidisciplinary evaluation team. So I'll now hand over to Dawn and the team to share some of the highlights from the fantastic work they did.
Hi, I'm Gemma, the Public Health Intelligence Manager at LEAP. I'm going to provide a high-level overview of the first part of the child outcomes analysis we did, which focuses on outcomes for young children supported by Lambeth health visitors. My colleague Dakota will then take you through the second part, which focuses on longer-term child outcomes. I'll give a little bit of background. As we've heard in the previous session, LEAP's theory of change prioritised the changes we wanted to achieve with children directly. We wanted to be able to use quantitative data to help understand LEAP's contribution to child outcomes. We worked with partners to agree data sharing that would provide access to administrative datasets in a linkable format with LEAP's data platform, and this enabled analysis of child outcomes outlined in our theory of change. I'll now focus in on outcomes for 2.5-year-olds specifically. For this project, we used quantitative analysis to explore associations between engagement with LEAP and child outcomes. We linked data about developmental assessments at 2.5 to data about engagement with LEAP services where the children within assessment or their parents had engagement recorded with a relevant service. The assessments at 2.5 years old use the Ages and Stages questionnaire, known as the ASQ3, a validated tool administered by health visitors. The tool assesses 5 domains. This work focused on communication and personal social domains, as well as a view of overall development. So, what we found. We did a lot of analysis, but I will focus on the main findings from statistical analysis of the linked data here. We ended up with a final linked dataset of over 1,800 children, and from this found that children from the LEAP area were significantly more likely to reach expected levels of development at 2.5 if their family engaged with relevant LEAP services than if they had not. More specifically, children in the dataset were 40% more likely to reach expected overall development, 70% more likely to reach expected development in communication skills, and 50% more likely to reach expected development in personal social skills if they had engagement recorded with relevant LEAP services compared to their peers who didn't. We also did some additional analysis of the number of services families engage with, which found that the more services a child's family engaged with, the more likely they would reach expected levels of development overall. To account for the impact some demographic and environmental factors could have on child outcomes, we included various factors in the analytical model, such as area deprivation, ethnicity, sex, and level of health visiting support a family needed. However, as this research uses population-wide data, there will undoubtedly be factors unaccounted for that we can't understand through large administrative data sets. So that was a quick whistle-stop tour of the ASQ3 project. I'll now hand over to Dakota to talk about outcomes for children in reception.
Hello, my name is Dakota Langhals, a senior data analyst in the evaluation team here at LEAP. In addition to looking at outcomes for children at 2.5 years old, we also wanted to take a slightly longer view. And to do that, we evaluated outcomes in the Early Years Foundation Stage Profile, or EYFSP, which is an assessment of school readiness and child development that is typically conducted by teachers at the end of the reception year. It assesses children in a substantially different way than the ASQ and asks different questions, but nevertheless, it contains outcomes along 3 domains that we also analyzed for the ASQ. Those are overall development, communication and language development, and personal, social, and emotional development. Now, the approach we took for this analysis was largely the same as the one we took for the ASQ, but we did have to modify our linking approach slightly because we didn't have the benefit of something like the NHS numbers that we had for the ASQ, which would have facilitated better connections between our data sets internally and the outcomes assessments that were provided by Lambeth Council for this assessment. So the chart on the right-hand side of the slide shows a descriptive picture of the outcomes in each of the 3 domains that I described a second ago, and it compares children who had family engagement with any relevant LEAP service against children who did not have any such family engagement. What we can see here is that children with relevant LEAP engagement reached expected levels of development in each domain at slightly lower rates than children who did not engage with LEAP. But descriptive views like that can't really account for things like variation between the groups in terms of their demographic characteristics. For example, so we had to analyze our data using logistic regression techniques that allowed us to control for sex, ethnicity, deprivation, English as an additional language, eligibility for free school meals, and assessment year. The model indicated that when considering all relevant LEAP services collectively, there were no differences between the engaged and non-engaged children in any of the outcome domains at conventional levels of statistical significance. But there's some nuance to that story, which in broad terms is that the type of service seems to matter quite a lot. More specifically, if you look at services that specialize in social and emotional development or LEAP's targeted services, then engaged children are slightly less likely to reach expected levels of development in all 3 outcome domains at the end of reception age than non-engaged children. However, if you look at children engaging with LEAP's universal services, they're actually more likely to reach expected levels of development overall, and no more or less likely to reach expected development in the other domains. Of course, there's a lot of detail about these findings and their limitations that we don't really have time to get into today, but I do encourage you to read our lovely reports that discuss these things in much greater detail than we can here. The next slides will cover outcomes for parents as analyzed by Sean Manzi, one of our colleagues at Dartington Service Design Lab, who has done some fabulous work in that domain.
Hi there, I'm Sean Manzi, a senior researcher from Dartington Service Design Lab, and I've been leading on the collective evaluation of the parental outcomes for the LEAP programme. So when we're talking about collective impact, what we're talking about is the combined impact of the different services on parental outcomes as an overall concept. So not the way that the individual services were able to impact and change outcomes for parents, but how the services in a combined way, parents accessing multiple services and across services, how overall they were able to impact on parental outcomes. Now, this is a challenge because we've got to combine different outcome measures, and we were looking at these under two different areas. The first of these was mental well-being, and the second being parental knowledge and application of positive, sensitive and responsive parenting. For mental well-being, we were looking at combining three different measures. The Core 10, the Clinical Outcome Routine Evaluation, the Short Warwick Edinburgh Mental Wellbeing Scale, and the Hooley Depression Screening Tool. And these three different measures were being collected across two services, the Domestic Abuse in Hart's Caseworkers Service and Baby Steps Service. For the parental knowledge and application of positive, sensitive and responsive parenting area, we were looking at two different measures. The Prenatal Attachment Inventory, PAI, and the Mother's Object Relations Scale, MORS. And so within each domain, we were trying to combine the different measures into a single measure of collective outcome. And we did this by transforming the different measures to a standardized scale between 0 and 1. This is called minimum maximum normalization. So being able to combine all these different diverse measures using this scaling approach has enabled us to actually look at the overall combined impact of the services rather than just the impact of the different services individually. So we've been able to come up with a collective impact score under the two domains of mental wellbeing and parental knowledge and application of positive, sensitive and responsive parenting, and be able to look at how the LEAP programme impacted on these areas for parents. So we can see when we look at this for mental well-being, overall we see an increase from before parents have engaged with services to after they've engaged with services. The line here is increasing upwards, and that shows an improvement in mental well-being overall for parents. So this change is roughly about 12% increase in mental well-being measures overall for parents. And this is statistically significant overall, showing us that we've got a clear and good change. When we look at this for the parental knowledge and application of positive, sensitive and responsive parenting, again, the line's going in the right direction. We can see that there is a change from on the left, where we got the score from before to the score afterwards. And overall here we're seeing about a 5% increase in parental outcomes here. And this is showing, again, to be statistically significant. We can drill down into this a little bit further and see that actually the collective impact overall across both domains for for those in different areas of local deprivation. And what we see is that across both domains, that the increase has been greatest for those in the most deprived areas. And this can be seen by, on the x-axis along the bottom, the number 1 represents the most deprived areas, and number 5 the least deprived. And we see the orange bars being the score before and the blue bars the score after engagement with LEAP services. And so the change overall has been greatest for those in the most deprived areas. And the stars above the bars show how statistically significant this change has been. And 3 stars being highly statistically significant. So for those in the most deprived areas of quintiles 1, 2 and 3, we see highly statistically significant increases in both mental well-being and parental knowledge and application of positive, sensitive and responsive parenting.
So, as those highlights from Sean, Gemma and Dakota demonstrated, we took a program-wide approach to understanding LEAP's impact. What difference did the program make as a whole? And as I mentioned at the start of this session, the way we did that was by treating all the different bits of evidence as tiles in a larger mosaic, which together tell us a story of LEAP. The service-specific evaluations designed and delivered by LEAP and others in the last few years are really important tiles in that picture. So I'm just going to give you a few highlights now to give you an overall sense of the positive picture these service evaluations offer. So, first up, LEAP's Domestic Abuse Enhanced Casework Service. So an evaluation of this service found large reductions in risk and distress, particularly for those in greater need. Then, for LEAP's Community Activity Nutrition Service, also known as CAN, an evaluation of CAN found that pregnant women with a BMI of at least 25 receiving specialist support through CAN increased their activity levels. And what about LEAP's Caseload Midwifery Service, which offered continuity of care? Well, an evaluation of that found reduced preterm birth and birth by caesarean section when compared with traditional care. And for LEAP's parenting programs, of which there are several, an evaluation of those services found that they helped parents develop closer bonds with their child during pregnancy and early childhood. And finally, LEAP's Making It Real service, which was LEAP's flagship communication and language service, an evaluation of Making It Real found that those attending Making It Real improved their home learning environment. So, taking a step back, what can we say about the impact of LEAP after 10 years of hard work by a lot of dedicated people? What is the mosaic of evidence telling us? Well, first of all, for children, there's tentative evidence that engaging with LEAP services had a positive impact. Children whose families participated were 40% more likely to reach expected levels of overall development by age 2.5. And these changes were statistically significant and suggest LEAP made a meaningful difference early on. But no significant differences were found at the end of reception between children whose families engaged with LEAP and those who didn't. Now that could be due to the gap between the end of LEAP provision, which stops before age 4, and the outcomes measured at reception. It's possible that persistent and high levels of need in families undermine the effects of LEAP over that time. It could also be because of limitations with the methods used. For parents and carers, there were also positive changes. So looking across a number of services, mental health and well-being improved by 12% between the start and end of LEAP support. Knowledge, skills and behaviour improved by 5%, and the greatest gains were seen among those from the most deprived areas. We've got good evidence that LEAP contributed to these differences too, and we'll get into that in the next section. These insights on parent and child outcomes help us to understand LEAP as a whole, but LEAP also carried out several service level evaluations, and overall, the picture is a similarly positive one, helping us to have some confidence that the mosaic of evidence we put together showed LEAP made a positive contribution to improving the lives of children and families in Lambeth.